a policy disagreement. This was a credibility test. During a heated confirmation hearing, Senator Chris Murphy directly accused the Surgeon General nominee of failing to disclose financial relationships while recommending health products to hundreds of thousands, in some cases, millions, of followers. And the exchange was blunt.
We'll now go to Senator Murphy, and for the awareness of the members, after Senator Murphy, we'll take a 15-minute break for the benefit of Dr. Means, and more importantly, the benefit of her child, and then we'll return 15 minutes, as said.
Thank you, Mr. Chairman. Good morning, Dr. Means. Dr. Means, are you familiar with FTC policy that requires those who are recommending products online to disclose their financial connection to those companies? In particular, the document from the FTC says this: if you endorse a product through social media, your endorsement message should make it obvious when you have a relationship with the brand. Are you familiar with that?
Certainly.
That guidance? As you know, there is a pending complaint regarding your failure to adhere to those guidelines that basically makes the contention, and this committee has verified the data that underlies their complaint, that you routinely violated this policy, and that, in fact, in the majority of your posts for many of the products you recommend, you did not transparently reveal your financial connection. Let me give you an example.
That's false.
Well, I'll give you an example. So there's a prenatal vitamin called WeNatal. Your filings before this committee show that you started receiving compensation in the spring of 2024. And yet in September of 2024, you posted a video saying that you had no financial relationship to the company, just a big fan. And then in October, you said, not sponsored, just love these. But in fact, you have documentation before this committee that showed when you said those things, you had a financial relationship. You had already started receiving money from that company. So you weren't telling the truth when you said you were just a fan. You were actually receiving money, correct?
If in any post where I said I am not receiving money, I had not been receiving money at that time.
But you had received partnership fees for this particular prenatal vitamin. In fact, prior to September and October, you had posted partnership links in which you get compensated based upon click-throughs, correct?
I'm happy to look at whatever documentation you're talking about, but I do not. It's incorrect, and it's a false representation. And just to be very clear, I've spent the last several months working with the Office of Government Ethics to be fully compliant with this process. I take it very seriously. Before, during, and after, if I am in office, I will be in full compliance with the Office of Government Ethics. I think, as I've talked about, conflicts of interest are incredibly important to rectify if we're in public service, and I am fully committed to continuing to work with them.
So let me give you some other examples. Function Health, which is your lab testing platform, data shows that you disclosed your partnership with them less than a third of the time that you recommended their services online. Genova Diagnostics, you disclosed your sponsorship in only 2 of the 9 times that you promoted Genova. Daily Harvest, you disclosed your sponsorship in only 3 of the 14 posts recommending that product. Zen Basil Seeds, you disclosed your partnership only 2 out of the 13 times that you recommended the product. This seems systemic. It seems that in the majority of instances in which you were, as a medical professional, recommending a product, you were hiding the fact that you had a financial partnership. You seem to be in regular willful violation of the FTC rules. That is concerning, as someone who agrees with Senator Cassidy that our focus has to be on restoring trust in the medical profession. And yet, over and over again, you seem to be at scale recommending products without telling your followers. And you have 200,000 newsletter subscribers. You have almost 1 million Instagram followers. And in only 3 out of 14 times on Daily Harvest, when you were promoting Daily Harvest, you disclosed that you're getting paid by them?
It sounds like you have a lot to say about this issue, and I would be very interested to see how your staff looked at this data. I have a strong feeling that the way in which they gathered this data is done intentionally to create these claims that you're making.
Well, I have the backup here. I mean, will you acknowledge that in many instances when you were promoting these products, you did not disclose that you had a financial relationship?
I don't think that's true. If it has happened, if it inadvertently has happened, I would rectify that immediately. However, I would be interested to see how your staff gathered this
I'll be
data.
happy to send it to you.
And I will conclude by saying that
Send
I
it to
take
all the committee
conflicts.
members. I mean, it's pretty incontrovertible evidence.
I take conflicts of interest incredibly seriously. I've worked diligently with the Office of Government Ethics to make sure that conflicts are addressed thoroughly.
The committee will stand in recess for 15 minutes.
Thank you.
Murphy cited Federal Trade Commission disclosure rules requiring influencers and professionals to clearly reveal financial ties when endorsing products online. The nominee said she was familiar with the policy. Then Murphy brought receipts. He referenced specific examples: a prenatal vitamin company, a lab testing platform, meal delivery services, supplement brands. In multiple cases, Murphy said, the nominee promoted products while telling followers she was not sponsored or just a fan, even though committee filings allegedly show she had already begun receiving compensation or partnership fees. Murphy's line was direct: you weren't telling the truth. That's not subtle oversight language. That's an allegation of deception. Now zoom out for a second. The Surgeon General isn't just another agency official. The role is often described as America's doctor, someone tasked with restoring trust in public health messaging. And we are living in a moment where trust in medical institutions is fragile. Vaccine skepticism is high. Misinformation spreads quickly. Public health guidance is politicized. So Murphy framed this as bigger than social media disclosures. He argued that if someone repeatedly failed to disclose financial ties while recommending health products, that undermines the very trust the office depends on. The nominee pushed back. She called the allegations false and suggested the data may have been gathered in a misleading way. She emphasized that she has worked closely with the Office of Government Ethics and takes conflicts of interest seriously. But Murphy pressed on. He cited statistics suggesting that in many cases, sometimes the majority of financial relationships were not disclosed when products were promoted. His argument wasn't that one mistake happened. His argument was that it looked systemic, and that matters. Because FTC rules exist for a reason: transparency. When medical professionals recommend products, the public deserves to know whether that recommendation is purely clinical or financially connected, especially when those professionals have nearly 1 million social media followers. I've of thousands of newsletter subscribers add a direct line into health decision-making conversations. Murphy's concern was simple. How do you rebuild public trust in medicine if you blurred the line between advice and advertising? Now, here's the political layer. Confirmation hearings are not just about qualifications, they're about judgment. And senators often use these hearings to test how nominees handle confrontation. In this case, the nominee did not concede wrongdoing. She did not acknowledge systemic failure. She said if any mistake occurred, it would have been inadvertent and corrected. But Murphy said the evidence was incontrovertible. That's a standoff. And it leaves open serious questions. Were disclosure standards followed consistently? Was there confusion about what qualifies as sponsorship? Or was there a pattern of promoting products while downplaying financial ties? This is especially sensitive because the nominee has built a public brand around reforming healthcare and challenging parts of the traditional medical establishment. When you position yourself as someone restoring integrity to the system, your own transparency becomes central to your credibility. And that's what this hearing really revealed. A fight over who gets to claim the mantle of trust in American medicine. Murphy argued trust begins with full transparency. The nominee argued she has complied and will continue to comply with ethics standards. The committee recessed after the exchange, but the political implications are still unfolding. Because at the end of the day, the Surgeon General's authority isn't enforcement power, it's moral authority. And moral authority depends on credibility. If this nomination moves forward, expect this issue to come up again. Because in a post-pandemic America, trust isn't optional. It's a essential job.